Do you have back or neck pain and ever ask yourself, is it possible that maybe I'm overstretching? You have this intuitive feeling that you have pain somewhere, you stretch it, but then as soon as you're done with the stretch, you feel like, I don't know if that really did anything. But the answer is, of course, yes, absolutely. It is possible. It is even probable that you could be overstretching. Most people are familiar with or have heard the idea that core stability is what is needed to give you good posture, good alignment, and to strengthen the muscles around the spine that protect and support it. Stretching is the opposite of stabilizing. Stretching loosens connective tissues around the joints and around the spine that make it a little bit more mobile. I mean, that's what stretching is for, to create mobility. And that mobility, again, is the opposite of stability. So for a lot of people, wherever they have that pain or that injury, whether it be on one side of their neck, one side of their back, their hip, there is a tendency, we just have this feeling that, oh, I'm supposed to stretch that area. It feels like it needs to be stretched. A lot of times it does not. It needs to be strengthened and stabilized with proper exercises. In some instances, on the opposite side, it might be tight. So give an example of, I have neck pain on this side and I just feel like I want to stretch it all of the time. And some people do. They stretch it, they stretch it, they stretch it. Those muscles are aggravated, they're irritated. The tissues underneath the muscles and the joints are aggravated and they're irritated. So people want to get at it and stretch it. Sometimes they never think to check the other side where it's limited. That's where the range of motion is restricted. So that might be the time where they need to stretch. And the same thing could go for something in the hip, in the low back. They're always trying to stretch to one side. They never really consider or think to check the other side. So it's those imbalances that really create a lot of asymmetry on the spine. You can really injure yourself with those imbalances. So you need to either be honest with yourself with an assessment and checking your range of motion side to side. Not so much, where do I feel this stretch, but what is my range of motion like on side to side? And it might be worthwhile to find a physician or to find a physical therapist, a chiropractor, a personal trainer, or somebody who can do the assessment for you and evaluate side to side, because we sometimes get caught up in where we feel it versus what the range of motion actually is. In those situations, of course, you want to stretch. Stretching isn't detrimental. You just want to make sure that you're applying the stretch in the appropriate area. Wherever you're tight, you should stretch. Wherever you're weak or unstable, you should stabilize and exercise. And sometimes you either need to be honest with yourself, like I said, and evaluate yourself, or find somebody who can help you out and find those imbalances so that you can have that good posture, good alignment, and then strengthen everything within that.